everyone. We still have people joining our July Provider Forum that's actually on July 1st. So we're excited to have everyone here. We're going to be talking about adult day training and group home licensing with Michelle Tolini. She is the CEO and owner of Adult Care Housing, where she oversees Medicaid waiver services for individuals with IDD. She has over 2 decades experience and has held leadership roles at the Agency for Persons with Disabilities and Pyramid. And Adult Care Housing is also one of our colleague members. So with that, I'm going to turn it over to Michelle. We will be monitoring the chat if you have questions, and then you can also, we'll open it up for Q&A afterwards.
All right, welcome everyone. This is going to be an overview of ADT and group home licensing requirements, a little bit of handbook thrown in there. There is a lot to cover. Dina, I'm going to ask you to keep me up on time.
Sure.
So we try to get through it. This is not inclusive of every single requirement that there is, so you guys know, otherwise we'd be having a full day training instead of an hour, but we've got a lot of content. And I am going to cover this from various perspectives, because I know we have a diverse group on here, from providers to support coordinators. I'm sure there are also some family members out there, so hopefully this will cover all your questions, regardless of your role. So let's start with adult day training. Adult day training is a day program service for individuals with IDD. The goal is to support the individual with their skill acquisition, retention, and independence. It also includes activities of daily living, personal care, social skills, socialization, adaptive skills, recreation, and you should be doing integration into the community, providing age-appropriate and mentally stimulating activities, and that is a quote from 65G2. Group homes are essentially group homes. Most of our homes are licensed for up to 6 people. Those that were licensed before 2014 may have more, and their standards are a little different because they're grandfathered in. And the group home environment, we assist with personal care, supervision, activities of daily life, accessing community resources, assisting with management of health, behavioral needs, financial needs, and anything the individual needs to be independent. We're going to start with the licensing application process. Applications need to be submitted to APD at least 45 days prior to the expiration date. Failure to do so could be a Class 3 violation, and we'll talk more about the violations. The review process is the agency reviews the applications. They make sure they're in compliance. If there's anything that's not there, they will ask you for it, and you need to get it back to them in a very timely manner. This process is the same for both group homes and day programs. Licenses are only valid for the time that is stated on the actual license. So for day programs, they can be licensed up to 3 years, and group homes can be licensed up to 1 year. And just a couple notes, licenses are only valid for the applicant and premises that is specified. So I cannot go sell my business to somebody else and they cannot just take the license from me. They have to reapply for relicensing under their own name and their own company at that specific location. They are not transferable. They are not assignable to anybody else. If you are closing, selling, whatever, you need to give at least 30 days notice. On a personal note, I would encourage you to give as much notice as possible so it does not disrupt services to your clients. As we know, it takes time to find the right placement, whether it's a group home or a day program or other providers or any service. So as much notice as possible so you can help with that transition is best practice. If for some reason you received a foreclosure notice, something happened where you're renting, you can no longer stay at that location, you need to notify APD within 24 hours. Agency monitoring and oversight. For initial renewal monitoring, the agency has to come out and review the facility. We are subject to ongoing monitoring. For group homes, it's typically monthly. I believe that the intent, once everything is kind of organized and flowing, is that licensing should be about every 3 months for your health and safety monitoring at ADTs. That has not started. APD is still working on the licensing process, which went into effect at the end of last year and has transitioned into this year. Now, just so you know, APD can come out more than once a month. If you have some type of deficiency and they want to make sure that you have actually gone through and gotten done what you said you were going to get done, they can come inspect. So if you had property damage that needed to be fixed and they want to make sure it's done, they can come out. Now, there are some rare occasions where there are suspensions of monitoring. Typically, you're going to see that when there's some type of emergency situation happening, hurricanes, and then they will be out as soon as possible afterwards. Facilities that have no current participants may not be monitored monthly. They could be less frequent. Follow-up monitoring, we already talked about. And of course, please make sure all your staff know that they are required to let in state officials with proper ID. Do not turn them away. It's not nice. They also are able to inspect your records, whether it's financial or client records, whatever they ask for, you are required to assist them. Facility and program standards. By and large, the majority of the standards for ADT and group homes are the same. There are a few exceptions here and there. So design and accessibility. Your actual location needs to make sure it's accessible for the clients that you serve. So if you're not serving anyone that requires assistive devices for mobility, such as wheelchairs or walkers, you may not need a ramp. However, you should make sure that your building's accessible with proper door sizes, hallways, that there are no architectural barriers that are getting in the way for your people. Interior doors must be openable from the inside. Exterior doors must allow safe exit. So you're going to see with a lot of these are going to be managed by your local fire marshal during their inspections. They're going to want to make sure that doors open and close, that you have safe exits. You're going to see that more in the group home than the day program. But please don't lock your clients in. That's how people die. Safety and maintenance, you need to make sure that your building's clean. There are no tripping hazards, exposed wires. Even if your client wants to run their stereo system across the entire room with 800 cords, you need to make sure it's safe so no one's gonna trip or hurt themselves. If you have clients that require equipment that requires electricity, you have to have some type of backup equipment in the event that the power goes out or they don't have a supply. So make sure you're always prepared for any eventuality.
Hey, Michelle, real quick, we have a question in the chat. What about private pay clients?
APD needs to approve private pay clients that are outside the scope of services. So I believe that's a little different in the day program than group homes. So I have not seen APD put out language where they have to approve additional clients outside the scope of private pay. In the ADT that may be coming, something I did want to mention is that APD is changing the language in 65G2, which is what we're talking about, doing some updates, and we'll discuss that a little bit more if we have time. So they have not said much about ADT private pay. With group homes, it has to be a person that has IDD, and they need to know enough about it to make sure that the rest of the residents in the home are safe. All right, back to facility program standards, and thank you, Dina, because the font is really tiny and hard for me to read in the question box. HIPAA, Alan, you're killing me. All right, HIPAA. So you can do a generic blurb about your individual. I am not an attorney, so I cannot go over the exact standards of what would be allowable versus not allowable. For me, I would use generic information that, John Doe has behavioral issues, he's a diagnosis of autism or whatever, without saying his name. These are the core behaviors that we're helping with. So you guys know, if you don't, I'm a behavior focused provider, so I'm usually talking about behavior related things. But they should at least have a general vague overview. And I would encourage you to have some type of sign off documentation that from the client or their legal representative that allows you to share their information with APD prior to them moving in and APD's approval, just to cover yourself for HIPAA. Let's talk about garbage. Garbage needs to be stored in covered containers and emptied regularly. So the goal there is to ensure that if there are any vermin, they cannot get into your garbage cans. Typically, you see that with trash cans that have food stuff, like your kitchen. The primary garbage cans should have covers. APD has never made us have covers on trash cans in bathrooms that are just for paper towels. There are more requirements for storing things that may have bodily fluids, and that would be part of your cleaning process and procedure. Ventilation and temperature control. Your program needs to be, whether it's an ADT or group home, between 62 and 80 degrees. If you go above 80 degrees, you need to either lower your temperature, get your air conditioner serviced. If there is an issue where it's not working, you need to let APD know immediately. There are allowances, obviously, for your AC going out and needing to be serviced, but it's something that you need to deal with quickly. As I assume we all live in Florida, it is not comfortable to not have AC this time of year. And if you are a day program that primarily operates outdoors or some type of enclave, you need to make sure you have an alternate location for inclement weather. This time of year it rains and storms frequently, so you need to have an option outside of being in the elements. You need to make sure you have adequate furnishings that are sturdy and functional to meet participant needs. Honestly, invest in it. If not, you're going to be replacing your furniture every few months, and it gets tiring and expensive. Bathrooms and changing areas, they need to have ADA standards. So in your ADT locations, you should probably have at least one toilet that meets ADA standard requirements with easy height, grab bar, whatever's needed. You can't have others that don't, but you should at least have one. All of your bathrooms must provide for individual privacy, be clean and hygienic. If you need a changing area for people where they can be totally assisted with changing a brief, you need to make sure you have that area also where it provides privacy individually and that you actually have that. Hot water must not exceed 120 degrees Fahrenheit. You are not required to have hot water in an ADT, but if you do, it cannot exceed 120 degrees. And you should be testing it. All areas must be suitably lit according to usage. There is a lot on food preparation, storage, and service. Let me preface that. In an ADT, you need to follow these if you are serving food. If your clients bring their lunches, then they are responsible for maintaining that safety or whatever home they come from. Should be making sure everything is stored properly, refrigerated properly, insulated properly. If you are providing food service in day program group home, you need to have dietitian menus. Your menu should be predated at least 2 days in advance, kept on file for a month. You need to make sure you're properly cleaning and sanitizing all equipment. There is a very long way to store food that I'm not going to go over. You're welcome to read about it in 65G2. Make sure your dietitians are consulted. You need to keep the documentation of their license for 3 years. Part of your food, anything that you open needs to be dated. If you take food that is perishable, that's refrigerated, and move it to the freezer, you need to note the date that it was frozen. Pest control and animal control. So you are required to make sure that your facilities are pest-free. If you have any type of infestation, you need to have a licensed pest control operator to address the issue. And you need to be able to show proof of that. So what we do is we keep our bill and we submit it to licensing to let them know that we are addressing any type of pest control needed. If you have animals on site or animals that visit, you need to make sure that they are currently vaccinated with their rabies and are utilizing flea and tick control. So what we do, because we have animals that visit our gentlemen that live in our home, so we keep a copy of their rabies vaccination on site if anyone has any question. Emergency management plan, also known as your CEMP, addresses pretty much every hazard you could ever think of. And it needs to be updated annually, and you need to train your staff. You also need to share these with your support coordinators. Mine's about 70 pages long, so I usually also give them a brief overview to add into the support plan if they need to. Transportation. So there's a whole note on transportation, and we're going to go into more detail under ADT, where you have to make sure that you are checking in and checking out as people are coming on and off your van. So you're listing names, dates, destinations, the staff involved. Your vehicle have to have a safety review daily, just kind of basic stuff, a walk around to make sure it's functional. You don't have any flat tires, whatnot. And you need to check that all your clients are off the van. And for this is really preventative. Unfortunately, there have been cases over the years where people were unnoticed and left in a van and they died. And that is preventable by just checking the van once you park and you get everybody off. It's unfortunate, but this is the safeguard that they've put in place to make sure it doesn't happen. And I know everyone's thinking this couldn't happen to me, but it could. You have multiple people in a van. They can be laughing, joking, fighting as they're getting off, and you might miss that one person out of 7 didn't get off the van, that maybe fell asleep or they're hiding or whatever they think they're doing. So please do this, double check, document it. ADTs need to make sure that they have a designated drop off and pickup area that's free from hazards and traffic. Programs must support full access to the community. Activities should be age appropriate, physically, mentally stimulating, and participant driven. So there's a lot of ways to make things age appropriate. I just want to talk about this for a minute. If you have a client that likes to color, you don't necessarily have to give them images to color that are babyish. Now, if they have a choice and they want to color Donald Duck or Mickey Mouse, that's their choice. But you can make things age appropriate. You need to make sure you're aligning participants' goals and choices and rights with your services you're providing. Smoking, vaping, and use of tobacco products is prohibited indoors in the ADT. All providers are allowed to have alarms and detectors on their windows and doors that notifies them if a door or window has been opened. It's very handy if you have elopement issues also. Smoke and carbon monoxide detectors must be in good working condition. You need to be testing them every 6 months and documenting it. Response to participant sickness. Areas that are contaminated with bodily fluids must be cleaned and disinfected immediately. Sick participants must be separated to prevent the spread of infectious disease. For those of you guys who provided services through COVID, think that way. If you have someone that you know has the flu, they should not be sat in a room with like 10 people around them. then they shouldn't be at your day program. In the group home, when we have people that are sick and contagious, what we try to do is make sure they can be in a room by themselves. Staff go in geared up, mask, gloves, whatever they need to prevent the spread of illness, to make sure the person has food and activities and are seeing their meds and that they can rest. So you need to have a policy and procedure for this, which I'll talk about in a few minutes. Financial standards, fiscal records must follow generally accepted accounting principles. You need to provide evidence of financial ability to operate for 60 days without state or third-party payments. All right, so you need to have enough savings for 60 days of payroll and bills in the bank that you can show APD. Those are your reserves. And most of you who have lived through the last 6 months have probably had to put that to the test in some way, shape, or form. And in ADT, firearms and weapons are only allowed to be utilized by certified security guards and law enforcement. You need to make sure your clients do not have access to weapons. Behavioral interventions, you must have policies that prohibit physical punishment, verbal abuse, humiliation, inappropriate sexual behavior. Staff need to be trained to respond to behavioral incidents and follow approved intervention plans. Specialized equipment, any type of specialized equipment that your clients use, whether it's a brace, a crutch, correct positioning in their wheelchair, you need to make sure you are training your staff and documenting it. You should also have a policy addressing that you are training your staff on how to use specialized equipment, document it. I would redo it annually with everybody to make sure that they are consistently doing it correctly. Remember that if you don't utilize special equipment correctly, your clients could be at risk for skin breakdown, bruising, any type of thing, and that's neglect. So please train. Participant records must include dietary plans, incident reports, medical information, transportation logs, maintenance records must be retained for review. Please make sure ADTs and group homes and families that you are sharing dietary restrictions and changing and training your people on them. People can be at risk very easily and unintentionally put in harm's way if you don't know someone's dietary plan. I think our ADTs will get this. Someone forgets their lunch and your staff are like, oh, I'll make them a peanut butter and jelly sandwich. Well, that could be deadly to anyone that has a choking risk, right? So you really need to make sure everyone knows limitations. There are, people with gluten allergies. If you're throwing a pizza party and your client has a gluten allergy, please make sure that you get something they can eat while you're throwing a party. It's no fun while they watch people eat pizza that they want to eat if they can't. We talked about foreclosures, evictions, and bankruptcies. APD needs to know within 24 hours. Prohibited areas, occupied dwelling, storage unit, and garages cannot be used for ADT services. Group homes cannot be within 1,000 feet of another facility. And you cannot use mobile homes as a group home. Fire safety compliance. You need your documentation of fire safety inspections. Please make sure when you receive your safety inspections, keep the email showing that you received it directly from your fire inspector and include that when you submit it to APD so they know that it is valid. Apparently, there has been an issue around the state where some providers have been submitting fraudulent certificates, which is why they were requiring the additional documentation to make sure it's legitimate. I'm sorry, I'm trying to read your question.
Okay, so
Library.
the question is it possible to receive the sheet being presented if this list is not in this format in the handbook?
Okay, so Dina's going to share my PowerPoint or my PDF presentation with all of you. And the majority of this is in 65G2, the administrative code. Some of it is also in the handbook in the different sections. Hopefully, okay, perfect. So if you have an ADT, you need to have fire marshal come out and give you an occupancy for your facility. It is also based on the amount of toilets that you have. If you were grandfathered in, I forget the exact date, so please forgive me. Initially, you can have up to 35 people for every 2 toilets. If you are recently getting licensed, you are not grandfathered in, so you have to have 2 toilets for every 25 people, along with whatever is told to you by the fire inspector for capacity. ADTs have to do quarterly fire drills and inspections. You should also be doing at least one that is a disaster drill annually. Group homes are required to do it monthly. You are not allowed to conduct any type of fire or disaster drill between midnight and 5 a.m. However, the fire inspector does want you to do one late and early. So usually we try to do at least one at either 11 per year or like 5:36 in the morning to make sure everyone's awake enough to, or even can do it while they're a little sleepy. It's also good training for your overnight staff. Backup power, we already talked about. If it's medically essential, please make sure you have backup power equipment and supplies. For our homes, I just want to throw this out there. If you have generators, please make sure they're outdoors. Do not use them in any type of enclosed area. So I wanted to go over vehicle standards. So safety features for all of your vehicles, you need to have working seat belts, wheelchair tie downs if you transport people in wheelchairs, functioning heat and air conditioning. You need to have a working tagged fire extinguisher. Make sure your registration and insurance is in there. You should also have a first aid kit. You must carry the minimum insurance, and you cannot exceed capacity for your vehicles. So do not let people sit in the trunk, even if they want to. Your vehicles need to be maintained and in proper working order to ensure safe transport. Supervision, you must maintain your staff to participant ratio. So if you have clients in 1 to 5, you need 1 staff for every 5 clients. If you have clients that are in 1 to 3, you need to have 1 staff for every 3 clients. So you need to maintain that. We already know about safety restraints. You cannot leave residents unattended in a vehicle. Don't do it, especially because it's a giant risk to health and safety. It's also, at least in my day, we've had clients try to steal our van. So that's always fun. Transportation log. Now remember, this isn't just about doing the service of transportation. This is transportation for outings. You want the participant's name, the date of transportation, mode, destination, names of staff involved. You must maintain these for 12 months. You should also be documenting what you're doing in your quarterlies and annuals to get credit when you're audited. Drivers need to conduct a physical inspection and visual sweep of the vehicle upon arrival at the destination to ensure no participant is left inside. There is no smoking or vaping in vehicles. And again, the temperature needs to be between 65 degrees and 78 degrees while transporting. However, there is a note where APD put in there that it does not have to be between that temperature while loading and unloading. For those of us that have large panel vans, it takes a while for them to cool down. They use a push air system, so you've got to be driving to cool. And I know that because we repair our air conditioners all the time during the summer. So let's talk a little bit about staffing standards. ADTs are required to have a program director that is on site. They need to have an associate's degree or at least 2 years of verifiable experience in lieu of the associate's degree. It counts on a year-for-year basis. They need to be present during the program hours of operation, responsible for ongoing operations of the program. And if they have a backup director, which you should in case the person's out, they need to meet the same requirements as the backup director. It's also noted that there's a governing authority. This is typically, depends on how that you guys are organized operationally. Maybe your CEO, your HR, whomever, they are the legally responsible person. They assume full legal responsibility for the program's policy management, operations, and financial viability. They make sure that all rules and regulations are being followed, and they make sure there's some oversight and that you're doing what you're supposed to be doing. My organization, that's me, it's Tina, Tanya, and my manager's helping. In residential group homes, you have to have a facility operator. For us, those are our group home managers. They must be a person of responsible character and integrity. They should have 90 hours of coursework in a relevant field, or high school diploma and 3 years of relevant experience working with individuals with disabilities. They need to be on site or on call at all times. We also have a backup person if for some reason they're not available or busy dealing with something else. They oversee the ongoing operations of the group homes. They ensure compliance with 65G2, 393, and the rest of the applicable codes that we need to conform to. Transportation staff requirements. Staff need to have a valid driver's license. Let's start there. You need to check their driving history. You need to have a minimum of the last 3 years, and you need to be checking it annually. So the way it was worded was that you must have 3 years of driving history at all times, right? But it's actually every year you go in and you pull your driver's driving history, so you know. You need to make sure before you approve someone to drive that they have, in the last 3 years, they've not had a DUI or any other type of drug or alcohol moving violation charges. You want to make sure that there are no moving violations that resulted in suspension or revocation of their license. Please note, though, those are moving violations typically that are bad. You may see that you have people that occasionally have suspended licenses because they're in arrears for their child support, or they were late paying for their insurance renewal, so it was temporarily suspended. Those do not preclude people unless, of course, they're still in suspended status. And of course, they need to make sure that they are in compliance with traffic laws. For instance, we don't park in no parking zones and get tickets for parking. All right, direct service provider qualifications. You need to be at least 18. That is a standard requirement for all staff, 18 years old.
Oh, the mom?
They should have a high school diploma or GED and 1 year of direct care-related experience, which could be medical, psychiatric, nursing, or childcare settings, or of course, working with people with disabilities. Now, there is a provision for people that do not have 1 year of experience. And with that, we need to let our licensing person know immediately, or actually within 5 days of hire, that we have hired an employee with no experience. They are not allowed to work alone. They need to have basically line of sight or underneath the same continuous roof line supervision by a staff that is experienced and meets the qualifications. I would make sure it's experienced, not just meets the basic qualifications. They can go out in the community, but of course they have to have responsible staff supervision. You need to provide written notification to your regional office within 5 business days with the name of the staff at the facility where they're working. And after 120 days, you should be doing a performance evaluation to assess whether or not they have the ability to work independently. And you keep that in their file pretty much forever. I want to talk about staffing ratios for ADTs and group homes. And we're going to start with ADTs. So the primary descriptors for adult day training, ratio wise, you have your 1 to 6 to 10. So that means it can be from 6 clients to 10 clients with 1 staff. You are not to exceed a 1 to 10 ratio. So people in this ratio require just kind of standard support, minimal assistance, maybe an occasional prompt cue, wash your hands before you eat. Let's throw away your trash, things like that. Your 1 to 5 is moderate support, and it could be based on behavioral or physical need. You have routine prompts for supervision, occasional physical assistance for personal care, moderate behavioral needs. With the people with behaviors may require visual supervision during all waking hours, and occasional intervention for behavioral challenges. They do not require constant one-on-one attention. 1 to 3 is an intensive support level based on both behavior and or medical need or physical needs. Typically for personal care, the person is going to require total assistance, including lifting, positioning, physical support. You will probably have to change them multiple times a day when they go to the bathroom, feed them, reposition them, things along those lines. It's an intensive level. Behaviorally, you're going to have people that are on behavior plans. They're exhibiting behaviors that require frequent intervention or intense supervision. Again, these are your people that you cannot not pay attention to. One-on-one supervision for recipients with severe behavioral challenges or intensive personal care needs requiring constant attention and intervention. This is hard. Please let me throw this out there. For you ADTs that do provide one-on-one, please make sure you have a backup when your one-on-one needs a break or has to go to the bathroom or take a call. Because all of a sudden, usually what happens is that one-to-one goes from 1-to-1 to a client in a group of like 1 to 5. And that can be dangerous depending on the reasons why your client needs that one-on-one supervision. Okay, so make sure you develop that backup. When we start talking about group home services, it's not a strict staffing ratio. The level is based on the level they receive, which is again based on kind of the same similar breakdown of requirements is based on staffing hours. So a person that's rated at the basic level, very independent. Your group home's required to provide 2 hours a day of staffing, which would be 14 hours that can be utilized over a week. So for those of you who aren't familiar with ResHab staffing, so you get so many hours per day that you are required at a minimum to provide, but you can take those hours and put them over a week. So, Monday through Friday, your guys might be at their day program, their companion, a job. So, but they're home on the weekend. So you may need more hours on the weekend. So you have the ability to adjust that for when you have more clients at home. Minimal level is 4 hours a day. Moderate level is 6 hours a day. And when we talk about moderate, you're going to find that's actually a higher level of care than you generally expect. Usually those are people that require hands-on assistance, physical assistance, may need changing. Your extensive levels are when you start getting into major medical or behavioral issues. Your IB 1 to 6, they do not actually list our requirements under IB. And this is all in the handbook if you guys want to look at it. But the assumption is if a person is listed as intensive behavioral level 1 through 6, they should be receiving a minimum of 11 hours per day, generally more because they've been determined as intensive behavioral. Extensive 2 clients require 11, so at a higher level of need, you would expect they would receive more hours. Your EIB clients are required in this. I know my friends that provide EIB love that this is so clear cut. It's 1-to-1 during wake hours, 1-to-2 during sleep hours. So that actually, I've been told, is actually very nice and refreshing. So, and just to break down again on the different levels, your standard residential focuses on basic supervision and training. Your behavior focused residential standard specialized in behavioral interventions and monitoring. Intensive requires higher staffing levels and continuous supervision for severe behavioral challenges. And then your EIB guys are the most intensive, one-on-one ratios. They're required to provide 24/7 nursing care for medical needs if appropriate. And that's really heavy duty. Training for your direct care service providers. These are the requirements. This is in the handbook if you need to reference it. Everyone's required to have direct care core competencies. It's a very good introductory course for people being introduced to services. It includes person-centered planning, intro to developmental disabilities, health and safety, choice, rights, roles, responsibilities. It must be completed within 90 days of providing services. It is a one-time only unless you are required to retake it based on a low clearance score. Zero tolerance covers abuse, neglect, and exploitation, signs and symptoms, reporting requirements. This must be done prior to providing services and has to be done every 3 years. It could also be required again if there was an issue or a violation that fell underneath abuse, neglect, or exploitation. Overview of APD waiver requirements. It's an overview of Medicaid waiver, qualifications, services, and limitations. It's actually a pretty informative class. It is now on train for those of you that are older that remember the PowerPoint. It's now a train course. It needs to be completed within 90 days of providing services. It's a one-time only unless, of course, you're being required to retake it due to a low clearance score. AIDS, HIV, infection control, covers bloodborne pathogens and infection. This is in train. Again, it must be completed with 90 days providing services. And its recertification is determined by whatever course you take. So there have been several AIDS, HIV, and infection controls that actually do not expire. So you might only do it one time. I do encourage you to retrain your staff in this, even if it's informally. The medical innovation has changed so much since we've learned about this over the last 40 years. And you want to make sure that your staff really understand what the different methods are for assisting people, staying safe, what's a risk. It's very important. First aid and CPR. I'm sorry, I'm just looking at what's on here, guys. HIPAA is annual, completed within 30 days of providing services, required annually. CPR first aid must be done within 90 days. Recertification is based on the expiration of the provider you use. APD does not in any circumstance ever accept any type of CPR first aid training that is done online. You need to go to the handbook and make sure you're looking at the providers of these certifications and trainings that APD accepts, because there are multiple that are not accepted, and there are thousands of choices out there. So please pay attention to the handbook. It lists it all out. HIPAA also on train. Medication administration and validation. It is a very, very intricate rule and form, which is 65G7. You need to make sure, if it's applicable, that your staff are trained prior to administering or supervising the administration of medication. And this is an annual. And please, 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 if for some reason your staff are late or become uncertified because they didn't recertify in place, do not let them continue to pass medication. Have someone else that is actually certified to do it. Then recertify them, do a full recertification if they need to continue to be a med admin. Behavior emergency procedures, if applicable. This is required in your behavior focus and your IB homes. It can be substituted for RBT training. which is a requirement in EIB homes, even though I have it listed here as an 8-hour or the 20-hour behavioral intervention. Your behavioral emergency procedures, those are your PCMs, professional crisis. This is your whatever you have to do for reactive strategies. And I'm sorry, please remember if you have a client that has a behavior plan that requires reactive strategies, that you are trained to perform those reactive strategies as necessary, okay, and safely. And again, APD has an approved training list of the different crisis procedures that are out there. So please review it. I believe it's on the website under the behavioral section. 20-hour behavioral intervention training. I'm sorry, I skipped ahead to this briefly. That's a really good training. I have to say this. You're not required in the ADT to do it. It is a requirement for behavior focus and IB, but it is really the best part of behavior training. It's really talking about getting in there, developing rapport, learning how to de-escalate behaviors before they happen. And it's a great training. Even if you're not required, doing some type of form of this is really good because you're dealing with lots of people that have lots of personalities and lots of quirks. And it helps you manage that and keep things from escalating into a dramatic area. Client-specific training, behavior plans, dietary plans. You have a bunch of required policy and procedures, which I'll note, and then the standard for additional training hours annually is the same for both ADT and ResHab, which is 8 hours. And again, you go by whatever is required for your service topically. All right, these are policies and documentation requirements for your clients. You are required to have behavior plans, nutrition plans, and these are, if it's applicable, your transportation logs, your incident reports, daily attendance logs, your implementation plan, which must be developed within 30 days of initiating service or receiving the support plan. It needs to be updated annually. It can be updated more so if your client decides to change, they want to change what they're doing. That is their choice. You must provide a copy to the recipient, their legal guardian, and the support coordinator. You need a signature for proof. Your quarterly and annual summaries are required. The third quarter is the annual, which is due 60 days prior to the expiration of the support plan. You must include a summary of the previous 3 quarters. What I like to do on my annuals is literally have a section that is titled Annual Summary. That way it's easy to find for everyone that may be reviewing it. Staff records, you need to maintain name, address, phone number, job assignments, qualifications, background screening, training, performance evaluations, emergency management plan training, disciplinary actions if applicable. Just pretty much keep everything. And just a note, while APD requirements say you don't have to keep all training documentation, please make sure you keep anything that had a larger formal training. So if you did the full medication administration class, you want to keep every single training, even if it was 15 years ago, that shows that they maintained their eligibility and timeframes from the beginning of the time when they did the full training through their recertification. Same thing with your behavior assistant, which is the 20-hour, it's an 8-hour recert generally. Keep that so you show that they were consistently trained, because you need to show that they maintained their timeliness. Financial records, we've talked about this. Generally accepted accounting principles, 60 days of money. Your emergency management plan you have to have, that needs to be updated annually, trained annually. Transportation documentation maintained for at least 12 months. Make sure you're keeping your maintenance records for 12 months too. I'd keep them longer. Your policy and procedure requirements, which are in the handbook and 65G2. You need to have a sexual activity policy that prohibits sexual activity between participants and staff or anyone else that's covered in your house. That includes volunteers, okay? So if for some reason one of your employees and one of your clients want to run away and get married, your employee cannot work for you anymore. They need to quit, okay? You need to have guidelines for physical boundaries and supervision. There are some people that don't understand that a hug is a hug and that it's not a sexual advance. So you need to make sure you have those guidelines in place for your staff. It protects you, it protects them. Also, reporting requirements for incidents involving minors, behavioral intervention policies, how you're going to respond to issues preventing punishment, abuse, humiliation, noxious substances. That is not all inclusive. Your emergency management plan, your person-centered approach, health and safety policies, annual review of local sexual predators. That's where you print out the sexual predators that are within 1 mile of your facility and make sure you go over that with your staff and your clients so they know who to stay away from. Your background screening, you're rescreened every 5 years. That's the full process by date for each. Make sure you have a type of notification process, especially when you're ADT for times that you're going to be closed. I can tell you it irritates every family member and group home and supported living provider out there when you don't give us notice that you're closing for 3 days until the day before. Medication administration procedure, transition supports. This is important, and I want to put this out there to support coordinators too. If a client wants to move or change providers, you need to make sure you're allowing the providers to assist in that transition. We know the behaviors, we know what's going on, we know the health needs. And while you know that too, preparing someone that smooth transition, it's better for everybody involved. So please, please, please include everybody in the transition process. As it's not fair to the client if no one is sharing information from service to service, so they know how to serve the person best.
Hey, Michelle, we have
Yes.
about 7 minutes, and one question in the chat.
Okay.
And I want to see if anyone else has questions. So regarding transportation, what is the minimum requirements for insurance?
I would have to look that up under statutory requirements, but you need to have professional or commercial vehicle insurance if you are running a business now. And I think the answer will differ depending on your service. I do encourage you to have commercial insurance for your companions driving their own cars or have them on your insurance for safety. But I'll have to look that up. I can get that back to you later
Okay.
because I don't know it off the top of my head. I just depend on my insurance person.
Great. Do we have any other questions for Michelle? You can go ahead and unmute or put them in the chat. I do want to be mindful of the time. Anyone?
Yes, the DUI that she talked about earlier, does that refer to all employees or just those that work for ADT and group homes?
That is specifically for staff that drive. You should not be allowing your staff to drive if they've had any type of major moving violation that includes drug and alcohol or any type of physical safety issues, reckless driving in the last 3 years.
Got it. Okay.
Okay. Yeah. And honestly, even if you wanted to, if they're on your insurance, you don't want to pay for that. It's going to be really high.
It's a great question. Anybody else have any questions on what Michelle has covered or a topic that she hasn't reached yet? I think they're all soaking in the knowledge. So.
I know. I have so much in this. It's hard. So I only have one section left, and that's just
Sure.
licensing violations. APD will look at your violations and determine disciplinary action. Sometimes, there are minor things that they may let go. Sometimes there are bigger things that they may not. And it's a lot of it comes down to the risk that you're putting your clients into, and how often things are happening. So if you are frequently getting violations, it's going to build up. There are 3 classes of violations. Class 1s are ones that are a threat of death or serious harm, verified abuse, neglect, exploitation, or abandonment. You can be penalized up to $1,000 per day of the days violating. They do cap that at $10,000. You could be put on moratorium on admission, suspension, denial, revocation of license, non-renewal, closed. Class 2 violations are threats of health and safety or welfare that could cause harm if not corrected. And that's a penalty of up to $500 per day. And any of the above, typically you're going to get some type of written notice and be required to do a corrective action plan. Lesser ones, which are more operational maintenance issues that do not pose a threat, could be up to $100 per day per violation. And of course, the more violations you rack up, the more potential there is for major sanctions up to closure. And that was kind of my quick overview.
Great.
Are there any more questions, guys? I tried to put a lot in here, and it's kind of dry, so.
And like I mentioned, we will be sending out a copy of Michelle's presentation with her contact information. If you want a certificate of attendance, it will need to be requested, but please be mindful for everyone. This is a long holiday weekend, and we will try to get it to you as soon as we can. So we appreciate everyone jumping on. And if
not to
Go
give more
ahead.
work, I was just going to say, and not to give more work to Dina, but if you are an ADT or group home provider, this would count as 1 hour of additional training credit that you're required to have.
we can do what we can to take care of that. So, all right. Well, we will include all that information in the email that we send to all attendees. And thanks so much for joining us.
Thank you, guys. Appreciate you being here today. And feel free to email me if you have questions, okay?
Great. Thanks, Michelle.
Thank you.